Thank you very much, Asif. Mr. Chairman, ladies and gentlemen, good afternoon. Unlike Vebev's talk, mine does have the infirmary there, MRI, as you can see. And you can see just there that the sky is still blue, just like it is outside. So, yes, you are missing out. But don't worry, the sun will shine tomorrow. I would, before I start, just like to congratulate Vebev on managing to use the phrase knee buckling orgasm, or leg buckling orgasm in a talk. I wonder whether she gave that sort of interview to a News of the World reporter and he was tempted to ask whether there was any other kind, which I imagine there is not. So I'm going to talk about consent, photography and social media. I've sort of expanded that slightly, not to just include photography, but also to include audio-visual, so video recording as well, which is becoming increasingly used, as anybody who's seen any of the sessions today will be able to say. So I'm going to talk a bit about consent related to those two media, and I'm also going to talk then about social media, because like it or not, social media is clearly here to stay, and you only have to log into Twitter to see that the traffic is quite enormous today, and I'm sure that will increase as time goes on. Now, everybody knows that consent, it's not a point in time, it's an entire process, and it begins with the GP allowing or seeking permission from the patient to have a referral up to secondary or tertiary care. When we discuss things with our patients in clinic, part of that is the process of informed consent. We are giving them the information that they can process and hopefully then arrive at a decision. From there, you might take consent in clinic. Can I just have a quick show of hands? Who takes consent in clinic as opposed to on the day of surgery? Who does it in clinic? There's quite a few. And who takes consent, the written consent, on the day of surgery? Okay, quite a lot. And I suspect if anything did happen and you were faced with a fairly decent QC, they might say, well, how can you take consent on the day of surgery? It is a process, but they've got to sign a form, haven't they? The patients come in starved, under duress, usually half naked, perhaps wearing one of those ineffectual hospital gowns. So it might not be that consent on the day, other than verification, is the appropriate way forward. So it's an entire process, and it won't surprise you to know that the GMC, this is why we pay our money to the GMC, have a good medical practice guide from 2013. I don't know if you can actually read that there, but this will outline the entire process for consent. And as everybody who teaches in medical school will understand, this is really all about the patient. It's us telling the patient, but more importantly than that, we've got to tell the patient in a form and in a way that they can understand. The patient has to have capacity, and that capacity is specific to both time and to procedure. So, for example, you might be able to give permission, you might have capacity to have a blood test. You may not have the capacity to consent to a radical prostatectomy. Okay, they're different things, aren't they? So the patient has got to be able to understand the implications, not just of having the treatment or the investigation, but also the consequences and the implications of not having that intervention. They've got to be able to process and weigh that information up, and they've got to be able to decide upon a course of action. Okay, so it is a complicated situation that we often, I think, simplify just by merely putting down the complications on a form and getting the patient to sign. That's not the case. And I think we must also remember that consent can be withdrawn at any time. Okay? Just because you consent in the clinic doesn't mean you will consent on the day. You may not even turn up on the day if our local population is anything to go by. The indications then for, and this again is from the GMC, for using audio-visual recordings can be fourfold. It could be routine part of care. There are a significant number of people who routinely video every one of their procedures. It may be important for pre- and post-comparison, and that's a fair indication. It may well be for research purposes, and again, that's a perfectly reasonable request and reason for performing, for recording anything that happens. It might be purely for teaching purposes. It might be for a publication in a book. But equally, it might be for broadcasting. And we mustn't forget that if there is broadcasting, there are other issues for consent, which we'll deal with in just a second. The consent you must get for recording must not only be from the patient, as we've talked about, but also from your employer, or from the person who is in control or in charge of the institution upon which you are doing the filming. This is usually either by medical illustration or perhaps from the Caldecott Guardian, which, as you know, will usually be your medical director or appointed representative. And if you are broadcasting, if you're doing things for television, whilst it may not be your responsibility to gain the patient consent, it is very clear from all of the guidelines, both from the GMC and Ofcom, that it is your responsibility to check that consent has been taken. It isn't good enough for somebody to say, oh yes, they've consented and it's perfectly okay. Now, in terms of photography, the standard consent form, lots of consent forms around the country, including my own, would have a little box, which I think you can just make out here, to say that publication could include an electronic form. And again, this is pretty widespread. It may well be that the policy in your trust is that medical illustration have to come and consent the patient. We have both. We are now no longer allowed to use our own photographic equipment. We have to get medical illustration up, and they create their own consent forms. So our patients usually sign 2 forms for any sort of recorded procedure. But there are pitfalls, aren't there? Don't use your telephone. Okay, the days of us going in clinic, and perhaps it never happened to other people, but the days of going into clinic and using your phone to take the photographs, they are well and truly gone. I imagine lots of people in the audience have children, is that right, with mobile phones? You can imagine my horror when I found out that my 13-year-old daughter was receiving my own text messages because our phones apparently were linked when we bought new ones. So there's nothing worse than your daughter saying, Daddy, I seem to be getting all your texts and all of your friends seem to be swearing a lot. What's going on? So don't use your own phone. Somebody else is bound to latch into it. Make sure that there are no hospital or NHS numbers around. It's very easy, particularly with x-rays. Okay, or for your screenshots from the electronic system. Make sure you can't see the face. I know these sound incredibly easy, but you'd be surprised how many people fall down on these things. Distinguishing features, and perhaps in andrology, they may be obvious, they may not be, I suppose. Depends on what an exhibitionist your patient is, I guess. Think about the dates. It may well be that actually each of these things appears to be fairly insignificant, but actually if you put them all together, you may have an element of breach of confidentiality. So all of these things are identifiers, and all of these things should be eliminated from any form of photographic record. Does anybody have Bailey and Love? You must have. This is taken straight from Bailey and Love, and as you can see, I think the standards for maintaining patient confidentiality are not fabulous, are they? I'm not sure that the cloth across his eyes is doing the job for me. I suppose he does have other distinguishing features. They haven't even bothered to cover this guy's eyes. I don't know. Anybody recognise this? No? Okay. Pinocchio. These are not my hands, by the way. No gloves, I'm assuming they're the patient's. So all of these things, you probably say, well, you can't identify that, could you? You probably couldn't. There's loads of people hanging around with this sort of thing. So we've just got to be careful with the photographs. The videos, actually, they're almost a step up. The consent form is the same, really. The consent process is the same as photography. But the pitfalls are perhaps elevated simply because you've got an element of audio risk as well. Okay? And you get the summation of information, and that increases the risk. So you need to be extra vigilant with video recording. Now, the GMC, again, going back to their guidelines, they have very clear and defined principles, and I won't go through them all. You probably can read them, but essentially, it's all common sense. Okay? Don't do things that will identify you. Make sure you stop when the patient decides they want to stop, and remember that consent is a process and can be withdrawn. Okay? Social media then. Moving on to social media, this is really just in memory of Tag Howard, and I'm sure that he would approve of this sort of, particularly the red box of narcissism for social media. We seem to follow everybody's life on social media, don't we? And it won't surprise you to know that there is a huge amount of guidance out there for professional use of social media. And that comes from pretty much everywhere you can imagine. It's a slight exaggeration to say that everybody creates guidelines, because of course if you go into most of the websites, they will direct you straight to the GMC. Okay, so although everyone claims to have guidance, the majority of them are a direct link, particularly the College of Surgeons, they go straight to the GMC. And amongst them, even if they are different, you get an element of commonality, and these are really warnings. The social media, without question, blurs any boundaries that may exist. And there is a real danger for professionals to have that boundary completely eliminated. So it's incredibly important that colleagues are appreciative of various things. And the first of these is the privacy settings. Oh, we set our privacy settings, only certain people can follow us, but actually lots of people can get around that. And no matter how good the privacy settings are, it's never truly private. And you have to keep that in mind when you engage in social media. And that brings us perhaps to point 3 of Webeb's talk, and that is the blush test. Would you do it again? Do you think you could have done things differently? It's a bit like sending an email in rage, isn't it? You always live to regret that. Think about your online image awareness, and not just from a personal perspective, but from your profession. We are all representative of a profession, and there is a danger of bringing that into disrepute if we forget that the things we post reflect on our image. And I think the other thing to remember is that this is a permanent record. If you post it on social media, you lose control of it, it becomes there permanently. You may be able to take them down, but they will reappear. The standards remain. The GMC is very clear about this. There is no question that the standards you would adhere to in normal practice also exist for social media. And you have to think about respect, not just for your patients, but for your colleagues and for the institution in which you work. The media is abound with stories of people who are disciplined, often sacked, for various infringements on various elements of disrespect. Maintain your boundaries, and this may even be maintaining separate profiles for your home and your professional life. As I said before, it's never truly private, it's never truly deleted. Okay? And keep an eye on for those identifiers, because there's a significant number of people out there who would happily engage in investigative behaviour in order to piece things together to find out and therefore breach confidentiality. So just to finish off then, really, the GMC principles are very clear. You need to have an indication for what you're doing, particularly if you're taking recordings. You need to be very careful to avoid any identifiers which may bring into the breach of confidentiality. When you're engaging in social media, particularly for posting of patient photographs and audio-visual recordings, think about the permanency. Okay? Think about the reach. This could go everywhere. It's never truly private. And remember the boundaries. So whenever you are taking photographs or audiovisual recordings, videos, make sure you have patient permission, written permission. Okay? And make sure it's very explicit that this may be for social media. It's very much like everything else, including chaperones, make sure it's documented very clearly in the notes. And I'll just leave you with one thought. I don't know if that comes out, but this perhaps will illustrate what Twitter's all about. Thank you.